Hi, my name's Lucy Excell. I'm a physiotherapist here at Applecross Physiotherapy, and I have a special interest in continence and pelvic health. I've been working in that field for quite a few years now, and I have a postgraduate qualification in that area. We can talk a little bit about incontinence. There are actually lots of different types of incontinence. I guess most commonly people would have heard about urinary incontinence. And the two most common types of urinary incontinence would be stress incontinence, which would be, say, leaking urine with exertion, things like coughing or sneezing, running, jumping, laughing, lifting, or exercise. There's also urinary urgency incontinence. So that would be continence that's usually associated with a really strong, overwhelming desire to empty your bladder, and then the leaking can occur following that urge. Sometimes there can be triggers associated with that. Some common ones would be getting to your front door and not being able to get the key in the door quickly enough, or maybe hearing the sound of running water is another common trigger for that urinary urgency. There's also incontinence associated with the back passage as well. So that could be difficulty controlling wind or even leaking bowel motion from the back passage. Both men and women can experience incontinence, and it can happen at sort of any phase of your life. So I guess some common points might be, say, for example, during pregnancy, the postnatal period it can come up. For men it might be following surgery to remove the prostate. And part of the management of incontinence would be a really thorough assessment. So aiming to really listen to the individual's story and figure out what type of incontinence they might be experiencing. There might be multiple types involved, and putting together the pieces of the puzzle to work out what all the contributing factors might be for that incontinence, and then using that assessment to work out a treatment plan for the individual person. I guess people have maybe heard of the pelvic floor. It's perhaps the more common thing. So treatment could involve doing exercises for the pelvic floor. And again, that would be based on the assessment and individualized. But it could look like strengthening the muscles or improving the timing or the endurance of the muscles, basically trying to improve the function of the pelvic floor muscles to help in their role with maintaining continence. As well as that, education is quite a big part of our role. So figuring out if there's any other contributing factors, lifestyle factors that might need to change to help to manage the incontinence. And again, that will be different based on the person, but it could look like things like fluid intake or advice around exercise prescription or modifications, retraining any of those triggers that you might have that we mentioned earlier, things like that. So really figuring out what all the pieces of the puzzle are, and putting it together for the individual person to manage their incontinence. So physiotherapy can be used in conjunction with things that might be more of a role of, say, a GP. So maybe prescription medications can sometimes play a role in, say, management of the urgency that we spoke about before. There might be need for, say, topical estrogen if you're in a postmenopausal period. So physiotherapy can work with your GP. Sometimes we need some screening done to look for things that might be contributing, like, say, urinary tract infection. Occasionally we would also perhaps want to involve other health professionals if they're not involved already, like urologists, gynecologists, maybe even colorectal specialists if the incontinence is more associated with the back passage. So we can all collaborate on what the best outcome would be for the individual person. And I spend at least an hour in an initial assessment with the person, listening to the history of the problem and trying to determine what might be contributing factors to that problem. And then the treatment management plan is putting that all together and figuring out what might be the best combination of treatments for that individual person. So that could be exercise-based with the pelvic floor, it could be lifestyle modifications, it could be advice on fluid, exercise modifications, toilet positioning, some behavioural strategies for managing leaking, things like that. So even with the initial appointment, we aim to give you some strategies that you can implement straight away to help manage the issue that you've come in with. And then a follow-up appointment will be to see how you're going implementing those changes that we've discussed, and follow up how you're going with your exercises if you've been given them. And then there will be follow-up appointments to make sure that you're not having any problems and to address any things that might come up along the way. But a lot of it will be up to you to be doing it at home.